Are you or someone you love struggling with invisible illnesses like fibromyalgia, chronic fatigue syndrome, migraines, or chronic pain, where symptoms persist even when tests are normal? You're not alone. I'm Dr. Michael Lenz, and in the Conquering Your Fibromyalgia podcast and YouTube channel, we connect the dots between complex conditions, share evidence-based insights, and offer hope for patients, families, and clinicians. Let's explore compassionate, whole-person approaches together. Have you ever felt trapped by chronic pain, worried that pills are your only escape? Or maybe you've experienced those moments where a perfect song cuts through the noise and briefly lifts the burden. If that sounds like you, stick around, because I'm going to reveal the powerful proven science that shows how you can use music to actively rewire your nervous system and turn down your pain volume. We aren't talking about simple distraction. We're talking about randomized controlled trials, the gold standard of medical evidence that prove music can significantly reduce pain, anxiety, and depression. This is your brain's natural pharmacy in action, especially if you are dealing with a complex, persistent condition like fibromyalgia. The mechanisms we're discussing today are directly relevant to conquering your daily struggle. Hello, I'm Dr. Michael Lenz. I'm a pediatrician, internist, and lifestyle medicine doctor, and the author of Conquering Your Fibromyalgia. In my practice, I focus on integrating powerful, safe, and effective lifestyle interventions. Today, we're diving into the amazing science of how music modulates your nervous system to deliver profound pain relief grounded in rigorous clinical data. What does the robust clinical evidence say about music's effectiveness? The idea that music heals is ancient, dating back to the Greeks. But it's only recently that science has quantified this effect, particularly for persistent or chronic pain. Two major reviews summarized the clinical efficacy of music: the 2017 Systemic Review and Meta-Analysis, Music-Induced Analgesia in Chronic Pain Conditions by Garza Villarreal and colleagues, analyzed randomized controlled trials involving adult chronic pain patients. The first finding was reduction across dimensions. The analysis found that music intervention effectively reduced self-reported chronic pain, but just as critically, music also reduced common disabling comorbidities, showing moderate benefits for anxiety and a high size effect for depressive symptoms. This shows music treats the entire subjective experience of pain, not just the physical intensity. The second finding was the power of choice. Crucially, this meta-analysis found a significantly greater analgesic effect, or higher effect size, when the patient chose the music. Self-chosen music compared to when the researcher chose it. This finding supports the hypothesis that cognitive and emotional factors such as the sense of control are key drivers of music's benefit. The multifaceted mechanism, the comprehensive 2024 review, looked at the psychophysiology of music-based interventions in the experience of pain by Arnold and colleagues, confirms that music-based interventions are non-invasive, safe, and inexpensive aids in clinical treatment. It emphasizes that the impact of music is multidimensional, varying across individuals and types of pain. The paper highlights that music modulates pain at multiple levels of the nervous system: the periphery, the spinal cord, brainstem, limbic system, and the cerebral cortex. These papers strongly support the use of music not as a distraction, but as an effective adjuvant therapy that acts directly on your internal pain systems. The brain's natural pharmacy. How does music flip the neurochemical switch? The underlying mechanism of music-induced analgesia is a top-down regulation mechanism that uses a complex interplay of neurochemicals. What central system acts as the brain's dimmer switch for pain? The brain's dimmer switch is the descending pain modulatory system, or DPMS. This system is your higher brain centers, where you think and feel, sending instructions down the nervous system, instructing the spinal cord to inhibit or diminish or stop pain signals from traveling up to the brain. What is the mechanism driving this? Music provides a strong medium for this top-down influence. The analgesic effect is linked to cognitive and emotional elements elicited by music, such as pleasure, distraction, anticipation, and a sense of control, all of which profoundly influence the DPMS. Which neurochemicals deliver the body's natural painkillers? Music activates your internal opioid system, relying heavily on the beta-endorphin system, your natural self-produced opioid peptides. These opioids attach to the mu-opioid receptors. These receptors are found in high concentrations in your reward and emotional processing centers, like the nucleus accumbens, NAC, and the anterior cingulate cortex, ACC, as well as key brainstem structures like the periaqueductal gray, or PAG, and the RVM. This co-localization highlights that pleasure and pain share a common neurobiology. So what's the proof? Reduced pain sensitivity after activities like communal music performance or synchronous dancing is interpreted as evidence of increased endorphin expression. This effect was demonstrably blocked by the opioid antagonist naltrexone in studies involving synchronous movement, confirming the opioid pathway involvement. The influence is not strictly central. Opioid receptors are also expressed on circulating immune cells, like macrophages. When stimulated, these cells can release opioid peptides that act on pain-sensing neurons in the periphery, like those in the dorsal root ganglia, or DRG, leading to reduced pain signal transmission. How does the calming hormone contribute to pain relief? The peptide hormone oxytocin, often associated with bonding and attachment, plays a critical, increasingly appreciated role in reducing pain and distress. Music-based interventions such as singing, drumming, or listening or playing music have been reported to increase serum or salivary oxytocin concentrations. Oxytocin is a positive allosteric modulator of the mu and kappa opioid receptors, meaning it acts like a booster switch that enhances the effectiveness of your body's natural opioid painkillers. Oxytocin also delivers powerful anxiolytic or anti-anxiety and calming effects, helping to reduce the overall negative emotional burden associated with chronic pain. Oxytocin receptor sites overlap significantly with pain processing and music activating areas in the brain, including the PAG, ACC, NAC, and the insula. How does music's reward driver enhance analgesia? Dopamine, the chemical linked to anticipation, motivation, and reward, fuels the positive experience of music that feeds the DPMS. Dopaminergic neurons primarily influence structures like the NAC and the prefrontal cortex, also known as the thinking center. Dopamine is particularly important in mediating the rewarding experience and anticipation elicited by familiar music. What about pain pathway influence? This reward pathway isn't separate from pain control. Dopamine influences the function of the PAG, thereby contributing to the descending modulation of nociception. What supporting chemicals modulate the pain control descending to the spinal cord? Two key monoamines, serotonin and noradrenaline or norepinephrine, are integral to maintaining descending inhibitory control. These chemicals originate in the brainstem nuclei, serotonin in the raphe nuclei, and noradrenaline in the locus ceruleus, and project down to the spinal cord. They are components of diffuse noxious inhibitory control known as DNIC. This system provides crucial anti-pain effects. What about the stress reduction? Music exposure has been associated with the reduction in noradrenaline levels, indicating a beneficial shift towards a state of rest and reduced stress. What are practical application and systemic benefits? How can we maximize music's pain-relieving effect? The single most important practical finding highlighted by the Garza, Villarreal, et al. In the 2017 meta-analysis is that the analgesic effect is significantly higher when the patient chooses the music. This finding suggests that the specific genre of music is less relevant than the music being familiar, pleasant, and rewarding to you. Self-selected music increases your sense of control and activates the powerful pleasure and reward circuits, dopamine and opioids, strengthening the brain's top-down modulation of pain. How does music affect the body's physical and immune status? Music provides systemic benefits by improving the body's underlying physiological balance. Music is highly effective in regulating the autonomic nervous system, which controls involuntary functions like heart rate and blood pressure. Music interventions increase heart rate variability and can lower heart rate and blood pressure. This shift indicates enhanced activity in the parasympathetic nervous system, the rest and digest branch, which reduces the release of stress hormones like cortisol, adrenaline, and noradrenaline. Are there any immunological effects? Music-based interventions have been shown to impact the immune system. For instance, listening to or performing music can significantly increase salivary immunoglobulin A, an important antibody, and reduce plasma levels of pro-inflammatory agents like cytokine IL-6. So what are some key take-home points? 3 things I want you to remember to put the science of sound into practice. Music is proven medicine. Based on these reviews, music is highly effective, safe, and inexpensive adjuvant therapy that significantly reduces chronic pain intensity and associated symptoms of anxiety and depression. Harness the power of choice. The analgesic effect is significantly maximized when you select the music that is familiar, pleasant, and highly rewarding to reinforce your brain's DPMS, the dimmer switch, and amplify the release of pain-relieving neurochemicals. Activate your internal pharmacy. Music works by activating specific brain circuits, resulting in a systemic release of natural painkillers, beta-endorphin, your body's internal opioids, oxytocin, the calming hormone that boosts opioid effectiveness, and dopamine, the reward chemical. This complex neurochemical response rebalances your entire system, including reducing stress hormones and inflammation. Thank you for tuning in. Remember that conquering chronic pain involves integrating all available tools, and music is one of the most powerful, positive, and readily available options you have right now. Until next time. Thank you for tuning in to this episode. If you're looking for more valuable resources, be sure to visit the Conquering Your Fibromyalgia website. I'd love to hear how this podcast has impacted your journey. Your feedback and questions mean so much to me. Remember, the information shared here is meant to inform and empower, but it's not a substitute for personalized medical advice. Always discuss your unique needs and options with your physician, as there is no one-size-fits-all approach to managing fibromyalgia and related conditions.